Good morning, the Ridge Medical Practice. Kelsey speaking.
We don't know if you have got a spleen or not. Are you sure that it was taken out?
Well, your son mentioned that you had some dark-coloured vomiting.
It was terrible.
Yeah.
Colour, frightening.
Would you be OK to go to hospital now if they could see?
Sorry, I know it smarts, isn't it?
It doesn't smart, just cold.
My hand was very swollen.
OK.
As though...
You hadn't been punching anyone?
No.
Katrina.
Come and have a seat. I'm Becky, one at nurse practitioner.
Sorry.
It's OK.
So...
You mum and dad?
Yes,
Yeah.
we are.
How can I help
She woke
today?
up about 6:45,
Yeah.
crying.
Yeah.
But it was intermittent crying. Anyway, I went into her, and normally she stood up in a cot singing away, and she was laid then, she couldn't move. Well, she could move, but not. She was really lethargic. Anyway, got her up, put her in bed with us. She never, ever lays. She did. She just laid for an hour, for just over an hour.
Yeah.
And then she was sick. And then every time I get her to stand up, she's right floppy.
And any rash anywhere?
No. I noticed there was a spot on her arm there. But that's... No, it's not a rash, that's all I've noticed.
Just one little spot, isn't it? Yeah. OK, that might come in at something, we don't know, but at the moment it's just one spot on her left arm.
Yeah.
Isn't it? OK.
She had Calpol at 8.
Right.
And she's just really not... This is not Heidi.
This is a patient education evening on viruses and bacteria and why antibiotics don't work. Deb, will you be a bacteria?
Oh, my God, Debs!
There. Right, you are going to be the audience, and those are antibiotics. So a virus would come in, and it would hunt for the cell it wants, and then what it does is it goes into that cell. This is the nucleus of the cell. It goes into the nucleus of the bead box, screws up the cell, remakes it to look like its own genetics, and then it sends that out to destroy another cell. That's how viruses work. I am in a cell. Then we have a bacteria. Da, 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 da. Now, when the antibiotics come, you have to die a terrible death.
Yes.
It's a theme tune. Right, throw them. Oh, you've got to die now.
You're supposed to be dying.
It's 7 days. Oh, slowly. Yes.
Go on, finish the course, Jan.
You've got to finish the course. Yay!
Hiya.
Hi there, come in. Come and take a seat, John. How can I help you?
I had a flare-up of my impetigo after returning to work on Monday. So when I came back home, obviously I'd had my hands in hot water and that, and been in quite a hot environment. Then it's caused it to itch and flare up.
You had them in hot water?
Yeah, because I'm in catering, so...
OK, I see. So water's probably the irritant then that you're exposed to. Let's have a look. Right, so a bit of dermatitis. It's mostly your left hand, isn't it? But you've got some here as well. Oh, it looks really irritating.
Yeah. Originally, I think it's probably got in because I have a cat who's sort of been scratching me quite a lot.
Yeah.
She's just that type of personality. She's a 1-year-old, yeah.
She
wants to go upstairs and chase and fight all the other cats, so yeah.
How many have you got?
5.
Right, OK. You got your hands full with...
Yeah, the last 2 weren't really planned for, but...
Yeah, it's often the way, isn't it? Yeah, we have 2. Right, so I think what you need is a bit of steroid in there. I think applying lots of moisturiser regularly as well will help.
Yeah.
Just make sure you dry them properly rather than drip drying. Dry with a towel.
I mean, honestly, I would prefer to take the rest of this week off if, you know... Do you have any disagreement with that?
No, I mean, you can self-certify for 7 days, and if you feel like that's the best way to get on top of this and get rid of the problem,
yeah.
I appreciate it.
I think it's just going to do the same again.
Yeah.
Okay.
Right, so let me get you some steroid for the hands.
Yeah, went to the vet, took my cat to the vets because I've got a cat with a poorly leg. So I was getting wound up about that because they were trying to give her a blood test and she wasn't having it.
Yeah.
So...
Yeah, it is quite traumatic blood test for cats. They have to take it from under the chin, don't they?
Yeah.
Sometimes. My cat has an overactive thyroid gland, so he has to go for blood tests regularly, and it is quite traumatic for them, isn't it? Mm. Is that a good book?
Yeah, it's the first one I picked up this morning, but yeah, it's just in my bookcase and grabbed it, but...
Do things like that help you?
Yeah, sort of understanding what you're feeling, yeah.
Yeah. Help yourself in a way.
Yeah, I haven't really read books like this for a while, to be honest, but yeah, just...
I guess everything's getting on top of you a bit at the moment, is it?
Yeah.
With your skin and your hands and
well, it's the new cat isn't getting along with the other cats, so there's jealousy and stuff, and she's wanting to chase them all the time, and... Yeah. I want them all to get along.
I know. All right, then. Nice to meet you.
Thank you.
Use that twice a day for a couple of weeks, OK, on your hands.
Thank you.
OK, bye-bye.
I've got one cat that's a right tart and they'll talk to anybody, and one that doesn't like people. And he didn't recognise me when I come in, and he absolutely went like that on the steps. And I went, hiding from me, and I went, it's me, you daft mare. And I went, hello, and then he went, oh, I came trying.
It's funny, right? When you tell people that you talk to your cat and your cat literally answers back, they don't believe you.
But they do, don't they?
Yeah, especially when I open the door to let them in and she goes, meow. That to me saying, thank you.
Yeah. Right, darling, look, we're going to look in your ears. OK, and round the other way. So there was no shaking or anything, twitching, nothing like that this morning?
No.
Do you want to take her shirt off and we'll have a listen to her heart and everything? Well done. It's worrying what you've said about this morning, and I get that she is, you know, she is quiet. Can we pop her down and see if she will walk? And
Right, walk to Mummy. Come on. Oh.
Well, she's wobbly, isn't she?
Let's walk over here.
look, I'll tell you what I'll do. I'll ring the children's team at the
she's
hospital. Just a bit wobbly compared to what she normally is. OK. Let's have a look. Oh, hello there. It's Rebecca Weston, nurse practitioner at the Ridge Medical Practice. Hi there. I'm just ringing for some advice as well, really. It's a 1-year, 9-month-old little girl, not as active as usual. Mum picked her up and felt that she was quite floppy. She vomited. She's come into surgery this morning, so she's awake, she's alert, but she's very, very quiet. OK. Thank you. Bye. Yeah, going to have a look at her on Ward 32 in view of what you've said to us this morning. Is that OK?
Yeah, that's fine.
Yeah.
Thanks ever
See you
so much.
later. Bye-bye. Oh, I got a little wave.
Oh, that's good. That's positive.
See you. Bye.
I'm so sorry to keep you waiting.
Well, you know, I've all day, you know.
Well,
I can keep
you're
going.
a busy man,
I
I'm
just
sure.
get out of the house.
Come and sit down. Tell me about what's been going on.
Well, there's been a few times that I've just been sick, you know. Go on my knees over the toilet, and it hit me bit by surprise, and it sort of rebounded onto a new carpet. It was terrible.
Yeah.
Colour, frightening.
Well, your son mentioned to our nurse that you had some dark-coloured vomiting. It wasn't kind of a coffee colour, you know, like a coffee ground colour.
It dried more blackish.
We always worry about anyone who comes in with dark-coloured vomiting, because what it might suggest is that you've had some bleeding in your tummy that's come up. And often, if there's any blood in the stomach, it comes up a dark colour.
No blood, not that.
Yeah. Well, it's the funny thing about when you vomit blood, it doesn't come out red, it comes out black or dark brown.
OK, you still having problems driving then? Yeah, I can't put my foot down.
I bought a motorbike yesterday.
Man with addiction to driving faces jail for handling. Well, how can you be addicted to driving?
In my house, there's 3 cars. They're lovely, them Porsches, aren't they?
Ever seen such traffic?
Come in. Hello.
Yeah, I've been already about 3 weeks ago last time, but I've been in butter show.
All right, no
Yeah,
problem.
I have a pain this side, I don't know. Head as well start like spinning.
And what do you
same
do
for last-
job-wise?
I'm driver.
Driver.
All the time I'm drive, every day.
Every day.
About 10 hours per day I'm driving.
Are you worried about anything in particular regarding this pain because you have seen somebody with this pain or
No,
nothing? So you have this pain all the time?
every day,
Every day?
all the time.
All
When
the
I-
time?
Yeah.
Okay.
Oh my God!
I'll give you a call.
Okay, just bear with me a second.
It's coming for you, Melody. It's right near you.
Get that away.
I'm not spiders. Don't bother me at all.
I don't like him. I do not like him. Disgusting creatures. I bet it's laid eggs or something.
Do you mind if I have a feel of your tummy? If you just come up on the couch for us here.
Oof.
Are you okay?
Yeah. I'm rocking and rolling as usual.
Can't ask for more than that.
No.
Sorry. No, you just stay as you are. I just want to press over here. Is that sore?
No. I can just feel you pressing it, but no, there's no pain.
That's good. Your tummy feels lovely and soft
Does
to
it?
me, yeah. When I heard you were vomiting up some possible
Yeah.
dark stuff, I was worried about your stomach and any bleeding in your stomach. But listening to you and having a feel of your tummy,
Yeah.
I'm not worried about bleeding into your tummy.
No.
So I think it's, like you say, food-related vomiting. So I'm quite happy with your tummy. I'm not worried. I don't think we need to do any further tests or anything like that. Is that all right, Mr.
For my
Hylas?
age, I'm not doing so bad.
Doing marvellous, marvellous. If I'm doing as well as you are at your age, I'd be happy.
Oh, dear.
Cheers, Mr. Hylas.
Thank you.
Thank you. I'll help you off there.
If I ask you to describe this pain, how would you
It's like tingles, like sometimes, you know, like sometimes start and after okay, and after again, after 20 minutes.
But no change when you eat or drink anything?
No.
Is it okay if I just quickly examine you?
Yeah, of course.
Okay, if we go. Okay, just lie down. Okay. What is this scar for?
I will translate after. And tell
Sorry?
you. I will translate after because I don't know this word English.
Okay.
What here somewhere, yeah, not a little bit up somewhere.
Here.
Here, yeah.
Pain here and pain there as well.
Well, here as well, but I can feel this because it's somewhere inside, you know.
Okay, you can come and sit.
I will just translate this word.
Sorry?
What I'm missing here. I will.
Was it the gallbladder?
Spleen.
You had
Spleen.
What was wrong with the spleen? Was it
I've
taken?
been 5 years old just.
Okay.
Yeah, and it was accident. So
Do you know the spleen is taken out or is it still there?
no, taken out because it's like.
If the spleen is being taken out, do we have you ever done an ultrasound or anything on your abdomen before?
No.
No. Okay. Because if there is no spleen, then there is certain medication you need to take regularly. We do that in
But it's
England.
been 23 years ago already.
Okay, no, what I'm saying is if you do not have a spleen, then you need to be on some sort of treatment regularly. We don't know if you have got a spleen or not. Are you sure that it was taken out?
No, should be, yeah.
Okay, I will refer you to have the ultrasound, I will inform them that this scar is because of the spleen, to check for the spleen and also because of the pain you have here,
Yes.
And we will take it from there then.
Yeah, okay.
Is that okay?
Yeah, Okay, thank you very much.
Is that okay?
Yeah.
All right then.
Yeah.
Okay,
thank you.
Have a nice day.
Thank you. Bye.
Okay, bye.
Potassium, it's not about bananas, but this represents potassium. So, you can come and be the heart. Right. Come on, my darling. So, you're the heart, okay? And for the heart to contract, we move in, and when potassium moves in, you relax. So you go stretch, you go wide, okay? And then when we move out, you contract. Right?
Yeah.
Now, if every cell in your heart goes in and then goes out and goes in and goes out at the same time, your heart beats.
Right.
Okay? Are you ready? And... Do you like this?
I like it. I love it.
Listen, but you'll know why. Yeah?
This is a way to get me exercise.
After we've done anything like this, I've got a pièce de résistance for, if you're 2 minutes, you can put it on. You'll love it.
Take a seat.
Thank you.
How can I help you today? So I had some scans done, I think it was last week, and they told me to come in and get the results from them and go through everything. Okay, and what, just remind me again, because I didn't see you when the scan was ordered. Why were the scans ordered? What's been happening? I was on my period, still am, for about 2 months now. Okay. So they did them. I was in on Monday for something else, and he told me that he said, he thinks I've got polycystic ovaries or something, but he told me to come back in and have a proper chat about it. Okay. So you were having sort of periods irregularly, or you having just periods that were prolonged? So it sort of started like I'd be on for a week, and then I'd have like 2-3 days off, and then I'd come back on again, and then I'd have like 2-3 days off, and I come, and it's only just sort of, I feel like it's stopping, but I don't know if I'm just going to come back on again, if you know what I mean. Okay. So when they did the scan, what it's picked up is in your ovaries there's this cysts or fluid-filled little pockets that they've found, and essentially those shouldn't be there, but they can be there without people having polycystic sort of ovary syndrome. The hallmark of polycystic ovaries is rather than what you see actually on the scan is what sort of symptoms that it gives you. So regular periods or too fewer periods, so they have like one every 6 months or whatever, etc. So before I started on the pill, I used to have like one every 6 months. Yeah, so it's irregular or even not many periods initially, but they can find excess hair growth. So I have excess hair growth in my chin is similar to that. And we know people with polycystic ovaries tend to, if they're trying to get pregnant, might struggle a little bit more than someone who doesn't have polycystic ovaries. Did you do any reading? Because Dr. I had a quick look, but everything I looked at just sort of made me think, oh God, so I just thought I'd just leave it. It shouldn't be an oh God illness, because it's not an oh God illness. It's something that we see a lot these days, unfortunately. Part of it is lifestyle, because we know people who tend to be a bit more overweight or they could lose some weight tends to have more of this resistance to those hormones. So your BMI, your body mass is slightly higher than what we'd want it to be. So the normal range is below 25 basically, and yours is 28 at the moment. So it just means that you're in the sort of overweight category. As health professionals, we are recommending weight loss more and more often. This is because of the rising levels of obesity in this country. Weight loss discussion is usually received well by the patients. They are usually aware that they should lose weight for health benefits and are aware that we have their best interests at heart. Yeah, exactly. It's hard though. It's hard. Yeah. I've been losing weight since February last year. Yeah. And I was 97 kilos. Really? Yeah, honestly, and now I'm I like to say 72, but really, I checked yesterday, I was 75. I'd gained some, but genuinely, so it's such hard work. Yeah, honestly, it's really hard. We have to persevere. Yeah. Let's get this weight down. It might be worth getting the blood test. You sort of meet the criteria for me to diagnose you with polycystic ovaries, but I think I probably should clarify with those blood tests. Okay, but I do think that's what you've got. Is that okay? Yeah, that's fine. Thank you. Perfect. Thank you. See you later. See you later. I like your name, by the way. Thank you. Cool. What can I do for you, my love?
I woke up this morning and my hand was very, very swollen. My arm was aching to the extent that it was quite useless. I could not even bend my fingers. They were very swollen. But also this little bit of a weald there, that I first noticed that last Thursday. But then this morning I've noticed 1 or 2 more seem to be forming.
Take your coat off, my love. Take your
Swelling
jacket
has gone down in my hand, but it was 4:30 when I woke up.
off. So you're well?
Otherwise, I'm fine.
OK, right, I'm just going to move your hand. I'm going to tell me if it hurts. Does that hurt?
No.
Nothing at all? Do that. Squeeze. Put my finger. Hurt me. You're good, aren't you?
There's a slight pain here, as though I've pulled a missile there, and a slight pain there, but...
This is really important now. When you say you couldn't use your arm, do you mean it were hanging down?
It was usable, but as though I'd done something strenuous and pulled a muscle or something like that from
so
here down. My whole arm was aching.
Aching, but you didn't have a period where you thought, oh my God, I'm trying to move my arm and it won't move.
It wasn't that. If it was, I think I'd have been off to
You know, we have to be
A&E.
really clear about that for mini strokes that can come and go. There's a few things, so I'm going to have a word with Rihanna, who's the doctor who's supervising me this morning.
Yeah.
The other thing, on your record, you're due for an NHS health check. You've never had your bloods done for a long, long time. So people like you, who are hard-working people who don't trouble us, are the people that we actually like to see. And I would recommend that you have an NHS health check and you can book on way out. And we check, it's to think about your heart, and we check your blood pressure, we check your cholesterol, make sure you've no diabetes. So that's a thing to think about. An MOT, but I'm going to have a word with the doctor because I just want to run this all past her.
OK, well, thanks for braving the snow.
Oh, I'm a bit chilly now.
Well, snow's melted now, hasn't it?
I hope it doesn't rain. I've just put some washing out. Did you see the rainbow yesterday? How are you?
All the better for this lovely weather.
I didn't want to come in today because of the lovely weather.
Sunny, sunshine.
Warm, innit?
I'm sweating.
So this is the time of year where we need to be careful in the sun.
This is blistered, I think, from sunburn.
I've got another doctor with me today. He's just behind you. Is that all right? She's observing.
That's not a problem at all, no.
Okay. Come on in, Have a seat. Right. I'll tuck that down there. So, how are things going?
Well, you did that one last, which wouldn't go away.
Yes.
It's gone nearly. It's nearly gone.
It's better, isn't it?
It's just a tiny
little bit there.
Okay.
Okay.
Gone.
Right. Okay. So you're keen for another
blast?
Another blast, if possible. Yeah. Okay.
Warwick suffers with actinic keratosis, which is sun damage from overexposure to sun throughout his life. The canister that I use delivers liquid nitrogen, which is very, very cold to the skin, which destroys the top layers of the skin and allows the healthy skin to come through.
Where's your hat? In the car. Tell me it's in the van.
It's in the van.
Right. Is it all right if we both have a quick look and a gentle exam? And you don't mind me just chatting to Dr. Black here so you can see some, generalised field change, we call that. Yeah, but the rest of it is lovely and smooth. OK, where's my dermatoscope?
Wish your wife would do that.
Oh dear. Right, where are we? Right, so you ready?
Yes.
Here we go. Four, three, two, one. Sorry, I know it's smart, isn't it?
Yeah, it doesn't smart, it's just cold.
It's cold, right, OK. So hopefully that should be it, but as we've arranged in the past, we need to keep an eye on you.
Yeah. Sadly, we do often see the same patients returning with sun damage. Those patients who are most vulnerable to sun damage include those people who've worked a lot outdoors and have had a lot of sun exposure, and also those with very fair skin or who tend to burn very easily.
So, you know what I'm going to say?
I do, yes.
That's the key thing, because you're still, you're very young, and when you get into your 70s, minimise the sun exposure now will make it easier for you when you're best. I know you do. I know it's not easy. I know. I keep lecturing you.
I know. No, you keep doing that. It just reminds me.
All right.
I'll keep an eye on that one then. Right. Thank you.
Grand. OK.
Right.
All right. Thanks for coming in. Then have a good day. All right. See you later.
Right, bye.
old manager of Man United.
Sir Alex Ferguson.
He was getting blasted at the moment in football.
What do you mean?
For a tattoo.
Oh, Sterling is. I love football. Why are you finding things that hard to believe?
Because you don't strike me as a football person.
I got no patience coming here. Chatting to Gareth and...
That's only because you'll have social media that you've seen it on. God.
Derek. Here she is, the expert. Hi, is it Derek? Hi, Derek. What's happened?
I just woke up this morning, my hand was very, very swollen.
Okay.
As though I'd damaged it in some way.
You hadn't been punching anyone?
No.
We never see this fella.
I never know.
We never see him.
No,
that's fine. Is it only ever this hand, or do you notice that other hand, just this one?
Just that hand. That's why I just thought it was arthritic in its
Yeah, and I think it's more likely to be that sort of arthritis, which is wear and tear. But because there is swelling there, wear and tear arthritis can cause swelling, but sometimes inflammatory arthritis, which is rheumatoid, those sort of things that don't tend to go with age, they can cause the same thing. I think we should just do some blood tests just to make sure we're not missing those. Is that okay?
That's fine.
So we'll arrange those blood tests done. In the meantime, we'll give you some anti-inflammatories for that. We'll give you a bit of steroid cream for those itchy things. I don't think it looks infected. Is that okay?
No
He's
problem.
going to book in anyway for an NHS health check, so we'll have them blood. That's fine. And obviously stop punching anyone, even if it's in your dream. Yeah, you can dream about it, but don't do it. See you later. Thank you, Ram.
Thank you.
Thanks. Your temperature's fine. Good lad. We want you to have an X-ray of your hand as well, just to be sure there's no arthritis. Is that all right?
Yeah, whatever.
Got to look after you now when you get over 60. We want you still coming here when you're 90. I might not still be here, though.
Nowadays it's wear and tear, but...
So you take this form to St Luke's, go and buy the hydrocortisone and hang on to that in case this pain gets worse. Is that all right? Nice to meet you, sir. All the best.
I hope I don't see you too soon.
Yeah, fingers crossed this will all settle.
Yep.
See ya.
Bye.
Bye-bye.
We go to number 12, and when you go inside, you need to behave like a really nice girl. I don't want the doctor to put injection on you.
Okay.
Come on.
Hi, come on through. Come and have a seat.
Thank you.
This is Dr. Adnan. Hi. It's one of our new doctors just joined the practice.
All right.
Do you want to have a seat as well?
Please, thank you.
Okay. So, what can I do for you?
Right, I've got pains in my body or bones, I would say. Like after his birth, even if I say I can feel it in my joints.
Okay.
I feel like a 50-year-old, to be honest.
Right. Okay, so, that's not nice to feel when you're not 50.
And I am already on iron tablets, though.
Okay. So is the main problem with your joints, then? Is that what you're feeling?
I think so, yeah. Even when I'm walking down the stairs, I can feel I can hear the sound of my bones.
Okay.
Which is quite weird.
Right. So where does it hurt exactly? Can you show me?
So, mostly it's this here.
Yeah.
And if I sit down, I have to hold onto something to get up.
Okay. Yeah. How are you sleeping? Sorry.
Well, it's not as bad now. He is sleeping through the night.
Okay, so that helps.
Yeah. But like I'm tired and exhausted after running after her.
Yeah.
He's been good, but she's hard work.
Okay. Well, let me have a look at you. So do you want to come across here?
Yep.
Your mummy's going to sit here. Yeah.
Do you want to wait, Xenia? Do you want to wait? Just for 2 minutes, okay?
You've not noticed your knee swelling, have you?
No.
How's that feel there?
Just okay.
It's okay. Here?
Just okay.
And here?
Okay.
Can you bend your knee? That's good. Does that hurt at all?
No, but I can feel like I've done something.
Okay, and then straighten it. That's good. And then this one as well. Is that okay?
Yeah.
Fine. Okay.
So
okay. Do you want to sit? You want to come round?
Yeah, thank you.
So, there isn't a great deal to find, okay, which is a good thing. All right. The joints all seem to be good and in working order. I'm happy to test a blood test for you. Yeah. I think it's probably, you've got a young baby, you've got a young child as well. You've got a lot of things on your plate, and that does make you tired.
Yeah.
All right.
Xenia, you're not supposed to do that. It's not a toy. Come on, please put it back, please.
For your blood test, do you want to book in here, or do you want to go down to St Luke's to have that done?
Well, actually, I do have a blood test
with
for
us.
my iron levels over here.
So that's fine. So what I'll do is I'll just add it onto that. There you go.
Right, that's fine. Thank you very much.
Right, take care then.
Okay, but just be very careful with them, okay? Thank you very much for your time.
Bye then.
Bye.
I'll open the door for... Oh, you can open your door for your mummy, good. Oh, it's heavy, isn't it? There you go. You got everything.
Thank you.
Right, take care. Bye then.
Bye. Xenia, you need to wait for mummy, please.
Are you ready, Janet? Big reveal. I want one! So it's a kidney day and you've got patients. What's the message, do you think?
I think it's to do with fluid retention in camel humps. Yes. I'm not just a pretty face,
So,
Jen.
unless you can retain fluid like a camel for 6 months, you must keep your fluid intake up. Do you like that?
Brilliant! OK, my love. So be here.
Yes.
They're beautiful.
Hi. Right, so I keep getting really itchy ears.
Yeah.
And I don't know if I'm getting really itchy ears again.
Yeah.
And this one has got like a spot in it now. And I don't know
Right.
if it's leading to an infection because I'm starting to hear a bit less now.
OK.
Don't want her to lose her ears and be like, I'm blind and she's
No,
deaf.
well, just between you might just be all right.
Maybe see no evil, hear no evil.
Is there anything coming out of your ears?
No.
Nothing at all?
It's just this spot in here, that's it.
And that's in your left ear?
Yeah.
And when you say your hearing's a bit down, is that a temporary thing?
Yeah, it's just, I think it is just because it's itching and all that.
Right.
It's not that down. It's just a bit muffly.
Oh, sorry. It's hard
Yeah,
because you've got your piercing there, haven't you?
It's here, it's hurting in the inside,
Yeah.
that one is as well.
It is always difficult when you've got piercings in. Because if you look,
Yeah.
that piercing there, you're not, I mean, it's nice, but you're not supposed to have piercings in these sort of places. So...
Take it out.
Well, no, we won't, you know, we don't
See,
make...
inside it's really hurting.
So you've got some wax in your ear and it's a tiny, tiny bit sore, but nothing major. You've got a lot of wax in your ears.
Okay.
And that one's a little bit sore.
So you're not intentionally ignoring me?
I think that we can give you some spray because that ear's a little bit sore. If that ear continues to be sore, you'd have to think about your piercings because it's not your drum or anything, it's your canal. And sometimes when you've got piercings close to your canal, it can just trigger something like a bit of an allergic reaction type thing. If it were happening a lot.
Yeah. Well, it does keep happening, so I might just take it
Well,
out.
we'll give you this. It's only this spray. You can buy it over the counter, but I'll give you one today. And it should dry it all up. And then, once you've used this for about a week, then you can put some olive oil in your ear because you have got a bit of wax and it'll just soften it. Never put buds in your ears. Do you put buds in your ears? Never clean them with shoving bits and stuff in them.
I always just clean around my ears in the shower and that's it.
Perfect. Keep them dry while you're using this spray. If you are washing your hair, get a big blob of cotton wool with some Vaseline on and just put that there to stop water going in.
Okay.
All right, my love. Nice to see you.
Nice to see you
See
again.
you
as
later.
well.
Thank you so much, Debbie.
Thank you.
Nice to see you.
Take care.
You too.
Bye-bye.
Bye. Bye.
Bye-bye, gorgeous.
Okay, Debbie.
Come in. Hello, hello, hello. Sorry for the wait. How can I help?
So basically, she's also got a tumour in her ovaries, and for the past week now, she's developed like a lump on her stomach. And the first day we didn't think much of it, and the second day the district nurse said it's quite swollen.
Is it painful? The dard hunda ya?
Ja, dardon.
Okay, ठीक है. 10 जैसे कि lump हैगा है ना?
Ja, soft पेट आ जाता.
Okay. So from reading the notes, they're saying it's fluid within the abdominal cavity, something called ascites, which you can get with the cancer. So if you try, and I'll just feel the tummy, hot bit. मैं थोड़ा पेट फील कर सकता हूँ तुसी top इतने check
कमीज थोड़ी ऊपर कर ला.
बहुत दर्द होता है. Very tense, isn't it? Oh dear.
Do you want to see some pictures? That's a beautiful picture.
Can I take a picture of it?
Of course you can, yeah. Don't put it on Facebook, though.
No, don't worry.
Just text me.
I will.
And I'm on WhatsApp.
What do you think?
I like it.
Let me show you some more.
She's like my mum on her iPad.
Amir, can I ask
beautiful.
a quick question? What else?
I'm busy, Robbie.
You must be the only person in practice that hasn't seen a picture of my belly split open.
Come in. Hello, is it Ian?
Yes, it is, sir.
Come in, Ian, take a seat. Right.
Right. Where do I start? I went away on holiday and I went to dip my toe in a swimming pool and it gave way and I fell in. And then yesterday I was at work and I just took a step back off a step because I work on step ladders and that.
Yep.
And I fell again.
Right.
And it's like I've got no power in that muscle there.
OK.
Yeah, I know I'm getting older, but...
Sure.
Yeah, I mean, I am 61. I go walking.
It's not old, 61.
I know, but I don't want to be on top of a mountain and it goes on me again.
Fine. Let's pop you on the couch. Have a lie down on there.
I mean, I feel fine, but...
Yeah. So, let's just start with this one then. So if we bend that hip, how's that?
Just a little twinge, that's all.
And then how far up can we go? Oh, yeah, quite far.
Yeah.
Okay. And what about if we just gently rotate this like that? Is that agony?
No.
And what about this way?
No.
And if we do that? No, it's not floppy,
pain.
is it?
No.
And then if we bend here... Now, can you try and push my hand away by straightening your leg? Yeah. Oh, that's very good. Can we do the same here? And then push away. Yeah, you're strong. It's pretty strong. You know, your legs are definitely pretty strong. Can you pull your ankle back this way? Yep. I'm going to push. Oh God, yeah, you're pretty strong. Yeah. And then push down on me. Yeah. Again. Yeah. That's fine. I think that looks absolutely fine.
Oh.
Is that hurting when you get up?
No, I'm just old.
No, I know. But don't blame it on age. What made you groan there? What bit do you think?
Like me back here.
Can you bend down? Well, you're better than me. Well, there's a slight bend in the knees there, wasn't there?
Yeah.
Come on, have a seat.
I'm just, I don't want to be falling at work, that's all.
Yeah. Why don't we refer you to the musculoskeletal clinic, which is a joint clinic.
Yeah.
Specialising in things like this, joints and muscles and nerves and things.
Magic.
Is that all right?
Oh, that's fine, Doctor.
So leave it with me.
Yeah, thank you very much, Doctor, for seeing me.
No problem. So when you do make it up Everest, which I'm sure you will do, you send us a WhatsApp.
Well, we're going to Lakes this weekend, you see.
Yeah. Well, when you're up at the top, you send us a WhatsApp.
All right, it's all on my Facebook. Thank you.
See you later.
All right.
Bradford.
It's Bradford.
Yeah, Bradford. Yeah, but your
Bradford.
accent's a lot more,
It's
not
a
accent, but voice a lot more posh anyways. You personally.
It's Bradford.
Bradford.
That is just weird.
I like it.
So her tummy is very tense and it's full with a lot of fluid. What I don't know is how quickly has the tummy started to become more swollen? Has it been quite dramatically over the past few days?
Yeah.
Because it's very tense and tender, isn't it? Would you be OK to go to hospital now if they could see and potentially get a drain?
Yeah.
Yeah, take it. Har phone card then, take it. I'll just get the telephone number. And the oncologist is based at Bradford as well, is that right? Hello? Hi there, my name's Dr. Seth. I'm a GP registrar calling from the Ridge Medical Practice. I want to speak to you about a patient with a view to doing a cytic drain. She's a 78-year-old lady who's got metastatic ovarian cancer, but she's got tense ascites, which is causing her pain and tenderness. Perfect. So send her to elderly admissions unit, yeah? Thank you for your help. Okie dokie, take care. Bye-bye. Right, so spoken to the hospital. They're happy to see grandmother and in a view to just getting some fluid off, which will start to help symptoms. Is that OK? There you go.
Thank you.
Tika.
And that envelope's to give to the elderly admission?
That's right. So that just everything you told me, my examination findings. Tika?
That's fine. Thank you.
My pleasure.
Thank you.
You're welcome. Take care. Okay, bye-bye.
Come in. Hello, is it Kian?
Yeah,
come and sit down. I'm Dr. Khan. Hello, that's a nice smile, isn't it? Yes, right. How can I help?
From yesterday, he started to get red spots, like blotches all over his stomach, and then after 10 minutes he went to his face and to his back.
Okay.
So I rang 111 because I got a bit scared because the first child didn't know what to do.
Fair enough.
By the time they rang me back 4 hours later, it calmed down.
Okay.
It happened again this morning, but it has calmed down a little bit again.
Okay.
So I just thought I'll come in because I'm appointment.
No, absolutely. Should we have a look at you, eh? Hey, that's a beautiful smile. Let's check your temperature.
He has had tonsillitis once before, and he's had infected tonsils as well.
Has he ever been in hospital with them?
No.
No. What's this noise? Did you hear that? Did you hear that? Good, his temperature's nice and normal. Do you mind just popping off his T-shirt for us? So I can see some of those spots. Yeah, so it was a bit more than this, was it, last time?
Yeah, and they're more redder.
Okay, so the good news is, when we stretch them out, I know, darling, they disappear. So that's the kind of worrying rash, you know, when they don't disappear, we worry about them. I know, but you were smiling at me a minute ago. Right, and what's this? Do you know what this is? No, he's not interested in that, are you? Should we pop it on your chest? That's it, good boy. Good boy. Where's that lovely smile gone? Hey? Right, so we'll have a look inside of his ears next. So if you just turn him to his side. Right, let's have a look. Good, and then the other side. I know. We'll be friends again soon when I'm finished, I tell you. Right. Good lad. Now the bit he's going to fall out over me with is his throat.
Goodbye.
Right, here we go. Where's that throat?
Goodbye.
That's it, finished. His throat and ears are a little bit red, but there's no pus in the back of his mouth. There's no pus inside of his ears to suggest anything too serious there either. His chest is lovely and clear, his heart sounds are nice and normal. It's common with viral infections like this to get a rash like this. So if anything changes, if you feel that he's not getting better, he's getting worse, or if that rash changes, we'd be more than happy to see him again. But as things stand, I know, he's not happy to see me, no. Well, you better get better then if you don't want to come back, eh? All right, perfect, there we go. Jimmy, no worries. Right, nice to see you both. Bye-bye.
Bye-bye.
No, he's thinking about it. Cheers, see ya.
Hope you feel better soon.
Yeah, fingers crossed.
Is that all right, Mum?
Thank you, yeah.
No problem.
Thanks.
Take care.
See you later, darling. Thank you very much. You're doing a lovely job.
Thank you.
All right, take care. Bye then.
Bye.